Well, I'm back for the second segment. I'm Walakira Dixon from Namugongo Secondary and Vocational School. Please subscribe to our YouTube channel. This website, that is nsvsnamugongo.com, to read more about what we are discussing today. Last time we discussed first aid. We got to know how to handle different injuries, how you as a person should conduct yourself during first aid. And today we want to discuss the DRABC routine of first aid. DRABC routine of first aid. Okay, so the routine is basically to give first aid to a person who has lost consciousness. For example, you are playing in the field, it is shining. For example, it is a race, then someone falls down all of a sudden while running and loses consciousness. What would you do as an individual? So that is where you as an individual, you use the DRABC routine of first aid to help that person. DRABC, we saw it in our first segment as a keyword, and now we are explaining the keyword that we saw in the first segment. DRABC is an acronym in which each letter represents what you take to carry out first aid on a casualty. Okay, the letters I order from what you start with as you carry out first aid. The DRABC stands for D, R, A, B, C. It stands for, first of all, danger. The second one is when you realize there is danger, now you look for response. Then the third one is airway. And the fourth one is the breathing. And the last one is called saturation. Okay, so these are the representations of the different letters in the DRABC routine. It involves checking for danger, first of all, whether the person is responding, opening the airway in case the person is unconscious, for breathing, and then enabling saturation. What do you do if an ill or injured person collapses in front of you? Now, for example, if you're here with me and all of a sudden I collapse, what do you do? What you do is to follow the DRABC routine. You could save my life by doing so. The aim of the DRABC is to keep the person breathing until an ambulance arrives. This is because without oxygen, the brain is damaged within just a few minutes and dead within 10 minutes. So, oxygen is very important to our life, to the brain, and therefore, you need to keep the person taking in oxygen by following the following procedures. That is, if the person is unconscious. Okay, so follow the routine and trust me, you will save someone's life. Okay, now the next thing, we have known what each letter in this acronym represents. Therefore, now we need to explain each and everything, each and every letter here. What I will start with is the danger. Let me first remove this. We explain one by one. Okay, the first one is danger. We have seen then D stands for danger. How do you check for danger? First stop, check for the danger before you rush to help the casualty. There could be danger from equipment, fire, gas, falling masonry, or fumes. So you have to make sure that that person does not get more injuries from those different equipments. If there is danger, do not put yourself at risk. Your own safety comes first. Shout or phone for help. You also need to be safe. Why rush? Don't rush. Make sure you call for extra help. If there is no danger, clear the area around the casualty, and this could be by stopping the game. That's why you see in different football matches, when a player is injured, the referee first stops the match to see what is really happening. Is the person playing or the person who has been injured in danger? So he stops the match to check, to know, is the person okay? Can we continue, or we need to put the person out of the field and then we restart our game? Okay, so after checking for the danger, you have realized there's either danger, you have done what you are supposed to do, and then if there's no danger, you know what to do now. The next thing you do is you go to R. That is response. Response. Now, how do you respond? How do you check if the person is responding? Because the person may fall down and all of a sudden the person is not responding. So you need to know, is the person responding or he is not? The first thing you do is shake the casualty gently, gently. I emphasize gently. Shake the person gently by the shoulders and shout, "Can you hear me?" You call that person to see what that person does. Usually, you can blow some air in the ear, in that person's ear. When you blow the air into the ear, usually we human beings have a quick response to that. So you can check by that. You can call the person. If he responds, okay, that is okay. If the person shows any response, he or she is cautious. Cautious means he can hear you, he can understand what is going on. You can tell from the response how weak the casualty is. So the person may respond with a faint voice when you have called them, so you will be able to know that yes, this person is cautious, but is so weak. Now, if the person can speak, find out if and where he or she has pain. So that you will ask the person where exactly you feel the pain, and you'll be able to start from there. Do what you can to stop the condition of the casualty from getting worse. First, stop severe bleeding. That is using the different materials that we saw in our last segment, and support the broken bones. That is if the person has a broken bone. Send for an ambulance as soon as possible. Okay, when you do that, trust me, you are saving someone's life. If there's no response now, the person is not responding. You call, the person is not here. You blow into their ear, person is not responding. What do? If there is no response, the casualty is unconscious. The casualty is unconscious. What do? This is a very serious situation, by the way, when the person is not is not conscious. Now, move to the resuscitation or make the person to gain consciousness. Now, how do you make the person gain consciousness? That is where you now go to A, B, C. And that is what we are going to explain right now. We shall start with A. You have realized the person is unconscious. So you need to make sure the person gains conscious. Then you go to A. A stands for airway. Airway. Okay. Airway. When the person is unconscious, the tongue can block the airway. So, preventing this is the most important thing you can do. There is a position you're supposed to put that person in order to unblock the airway. The person being unconscious is not in control of any of his or her body parts, including the tongue. So the tongue can fall anywhere and can block the airway. So the person cannot take in air. So what you do first is loosen the tight clothes. First thing is loosen the tight, loosen any tight cloth. These days, you young learners, you want to put on fitted clothes. When you get injuries, you cannot breathe. So the person giving first aid has to first loosen your tight clothes. So that is what you should do first. Then the second thing is shown in the picture that you're seeing there. You raise the chin and tilt the head back to open the airway fully. So the tilting is shown in the picture below. You can see how the head is tilted, and then the airway is unblocked. Remove any obvious fingers to scrub away any vomit. So if the person has vomited, you have to remove the vomit. Okay. The next one is the B. So you go to B after you have opened the airway. Now the person can take in air. You go to B. B stands for breathing. Breathing. So now, the first question you should ask yourself, is the person breathing? Is the casualty breathing? So, that should come to your mind first. How do you check to know that the person is breathing? The first thing you do is you look for the chest raise and fall. The next thing is you can listen to the breathing sound of the person. You see, we breathe smoothly, but we make some sound. So you can put your ear on the person's nose to feel or to hear that given sound. Then the next thing is you feel for the breath on your chest. The picture demonstrates it properly below. Then moistening the cheek will help you to know that the person is breathing. Because when you breathe air, that air contains moisture. So when you put your cheek to the person's nose and then you realize there's some moisture, it means the person is breathing. If the casualty is breathing, do what you can to stop severe bleeding and support the broken bones if they are broken bones. Okay, then place the casualty in a recovery position while you help, you get help. Now, the case happens, when the person is not breathing. But if the casualty is not showing any sign of breathing, you move to C. You move to C. C means saturation. Okay, saturation. C stands for saturation. How do you know that the saturation? Feel for the carotid pulse. Put your hand on the person's chest to feel that pulse. You can put on the wrist. You can also feel the person's pulse. Below the ear at either side of the Adam's apple. Okay, a pulse shows the heart is beating and blood is saturating. So that is when you know now there's saturation of blood. When there's saturation of blood, there's oxygen that is being carried by the blood to the person's brain. So meaning everything is now coming to normal. Then give a mouth-to-mouth ventilation, the one you call the kiss of life, the one you are more interested in when giving first aid. That helps to restore the breathing. Now, if there is no pulse, the first thing you do is to give cardiac massage and then mouth-to-mouth ventilation to restore saturation and breathing. Cardiac massage is, we are going to explain it in our next slide. You press the person's chest. You press the person's chest gently to make sure that now you are opening the lungs. Okay? Then mouth-to-mouth ventilation, we are also going to explain it in our next slides. So that should not worry you. Now, you have done the DRABC, is complete, but you realize there is no change. Okay, what next if the DRABC has not worked? What do you do? Okay, what next? What next? What next when there is no saturation? You have carried out the DRABC routine, it has failed, there is no saturation. What do you do next? The first thing you do is called the mouth-to-mouth ventilation. Mouth-to-mouth ventilation. In the mouth-to-mouth ventilation, you force air from your lungs into the casualty's lungs. The oxygen in this air can help the casualty, can keep the casualty alive. How do you do this? Make sure the casualty's airway is fully open. You know how to open the casualty's airway. Pinch the casualty's nostrils closed with your thumb and the first finger. The thumb and the first finger, you pinch the casualty's nostrils. Take a deep breath, you as an individual, then seal your lips firmly around the casualty's open mouth. Breathe out smoothly and firmly until you see a casualty's chest rise. Okay, when you see that, it means the person has taken in air. The next thing that you do as a person is after you have done the mouth-to-mouth ventilation, the next thing is called cardiac massage. Cardiac massage. Cardiac massage or external chest compression is a way of squeezing the heart so that blood is forced out of it and around the body. It is used in case of cardiac arrest. This is when the heart stops breathing, for example, during heartbreak. Cardiac massage may be combined with mouth-to-mouth ventilation so that the blood gets oxygen too. Cardiac massage is shown in the picture below. You can see how you press the person's chest gently so that you force blood from the heart. Okay, there are steps which you follow during cardiac massage. There are 8 which I want you to read through, and if there is any question, please type it in the comment section. I want us to talk about the recovery position as the last point. Recovery position. Okay, recovery position, that is usually the way a normal person is supposed to sleep. You as an individual, how you're supposed to sleep. It is the safest position for an unconscious breathing person. The head is tilted so that the tongue cannot block the throat. Since the head is a little lower than the chest of the body, vomit will drain from the mouth and not choke the person. You can safely leave an unconscious person in this position as you get help. Are we together? The picture is shown below, showing how you can put that person in a recovery position. So that marks the end of our segment with concluding questions of how you would attend to a casualty that is unconscious, and in practice, in pairs, maybe at home, practice and illustrate the recovery position. That concludes our segment. Please don't forget to subscribe to our YouTube channel. Don't forget to visit our website, that is nsbsnamugongo.com, and don't forget to read the content of Mr. Walakira Dixon from that particular website. In our next segment, we shall talk about the different injuries and the first aid for those particular injuries. For now, I wish you all the best.